Turning now to the COVID fight, and the U.S. continues to reopen as COVID-19 cases decline across the country. But Dr. Anthony Fauci is pleading with the public today to get vaccinated. He says the spread and dominance of the Delta variant, first identified in India, that is now dominant in the U.K., is a, quote, powerful argument for people in this country to get vaccinated. Joining me now to talk about that and more is Chris Meekins. He is healthcare policy analyst at Raymond James. Chris, good to see you. I know that your investment bank has been working on its weekly COVID-19 report for the past 70 weeks. You just issued your final report. Why have you decided to stop collecting that data?
Well, look, it's been a long, hard fight, right? And as Dolly said, it's a long, hard night, but there's a new day dawning. And I think what we've seen is really the dramatic progress in the United States. We have case counts that are down 95% from their January peaks, hospitalizations down more than 85% from their January peaks, and more than 170 million Americans have at least one dose of the vaccines. Now, there are still some things we need to pay attention to, but the reality is, as we've seen in the market for a while, it doesn't look like COVID is driving the market behavior in a huge way. And so we thought it was best to kind of reallocate resources going forward because of just how much progress we've made.
I know amidst your collecting of data and your reporting, you were able to break down sort of the government response to the pandemic, what the government did right, what it did wrong, perhaps some of the lessons that we can take away. Let's start with the positive and talk about what went right in the response to the coronavirus pandemic.
Yeah, I think Operation Warp Speed is the biggest testament right now. And even the vaccine rollout, there were a few bumps along the way, but the reality is less than 18 months after the start of this pandemic in the United States, we have vaccines available for every American who wants them. I've gotten both of mine. I hope the viewers are getting theirs. You have more than 170 million Americans have gotten it. The best experts thought it would take at least this long just to get a vaccine, not have this many in arms. And when you ask them how efficacious do you hope it is, most said they just hope it was as good as seasonal influenza, 40 or 50%. And we have 90+% efficacy for most of the vaccines here. That's remarkable and a huge testament to the public and private work that was done by government officials like Dr. Robert Kadlec, the Assistant Secretary for Preparedness and Response, as well as Peter Marks at FDA, who really hatched this idea in the beginning.
Mm-hmm. Well, you'll be happy to know I got both my doses, too. So we are vaxxed, as they say. Talk to me about some of the ways we could have done better and where there were some shortcomings in the response to the pandemic.
Yeah, sadly, the list of failures is greater than the list of accomplishments at this point. I mean, I think it started off with massive mistakes by the CDC on testing early on, so the virus was able to get out of control before we could get our hands around it. I think the government health guidance from people in the White House saying it's going to be over by Easter, no worse than flu, to CDC being too restrictive on schools, which gets us to our next point. We failed to educate our kids in an effective way when we know that there isn't big outbreaks. We've seen the limited spread in Florida as a testament to what could have been done across the country with school reopenings. And you have China's transparency. The reality is if China had been transparent when this virus first started spreading there, instead of making decisions to scoop up all of the mask supply globally to limit places like the U.S. before they disclosed it, we'd have been in a much better position than where we ended up being in the end.
What do you think some of the biggest risks are that we should be aware of? We saw Dr. Fauci coming out today and talking about that Delta variant in India, which is now prevalent in the UK, saying, you know what, don't let your guard down. That could very well and very easily wind up here in the U.S., especially because air travel has opened up as much as it has now, Chris.
Yeah, I think he's right. I think that the Delta variant is one that's of concern. It looks like the vaccines are a little less effective than it. It's still very effective, but a little less effective. And what the real concern is when you have areas of the country with just really low vaccination rates, states like Mississippi, where you have half the number of adults vaccinated compared to states like Vermont. So when we look across the country, it's really important not just that we as a nation get 70% of adults with at least one shot, but really that we have it spread out equally across the country and we reach out to those populations that have been hesitant to get it or maybe don't realize that it's free free, which some folks assume it means it costs money and they'll have to pay for it, or going door to door in communities that are in the lower economic realm and making sure they have the access they need to get it. So we've got some work still to do, but the progress has been remarkable, and it really is a new day.
That it is. And I just want to step away from COVID for a minute, because you are a healthcare policy analyst there at Raymond James. When you look at the broader scope of healthcare with the Biden administration, where are you seeing some opportunities right now for investors, perhaps perhaps unrelated to the virus?
Yeah, I think there's one area related to the virus, and then I'll talk unrelated. I think related, we saw the Biden administration release that they're going to increase investments to bring domestic manufacturing of key pharmaceutical supplies back home and make investments there, which is a huge step forward, something that clearly was needed as a result. But when we look more broadly, I think we saw with the approval yesterday at FDA of data on of a product from Biogen on shaky data, but political pressure still weighed in and ended up getting it across the finish line, shows you that the political power of the disease groups as well as the pharmaceutical industry. I think there's been a long kind of headwind to the pharmaceutical space, when the reality is we're probably not going to see Medicare negotiating prices. We're probably not going to see really problematic drug pricing reform from Congress this year. And as a result, you really have room to grow in those areas going forward. So I think large cap pharma, there are opportunities. I think there are opportunities within the managed care space, as well as, devices where you really don't have any policy issues presenting themselves at this point.
All right. Chris Meekins of Raymond James, thanks so much for breaking it down for us.